Dr. Burisch, you have just chaired the session Clinical and Observational Trials in Inflammatory Bowel Diseases. Are there any breakthroughs in IBD research?
Well, what we could see today was new data regarding a new drug on the market, etrolizumab. Today we saw results from studies on refractory IBD patients. So that was nice to see that in this group of patients who are difficult to treat, that we have options and that the results look promising so far. These are not finished studies yet, but the results look promising. Another thing that was interesting was we saw the first very preliminary data on an oral anti-Tnf drug, V565. I mean, we didn't see much about the efficacy, but this is a way to go in the future, delivering biological therapy through oral treatment instead of infusions. So that was very interesting, and we really hope that this is something that will pull through in the future.
What is your opinion on the safety and long-term outcomes in the treatment of IBD patients with biologicals?
Well, it is an important topic. Safety, I mean, not only safety, but also the risk for complications when you receive treatments that reduce your immune system. So this is something that we need to take very seriously. And drugs such as the orally delivered biological therapy that I just mentioned might eventually reduce the risk for instance, infections and others because it's locally delivered. So this is why this is one of the promising studies that we saw today.
Also, two studies looked at the introduction of etrolizumab as induction therapy for ulcerative colitis and Crohn's disease. What could be learned from those two studies?
Well, these were preliminary trials, but still, what we saw was that in a patient refractory to previous biological therapy, and in the UC, in the ulcerative colitis group, these were patients with very severe disease, that there is a possibility to induce remission in those patients. So there was a significant efficacy there, but we need to wait for the long-term treatment and for the long-term results and the full study before we can draw any firm conclusions, but it looks positive.
Where will research lead the field in the next 5 years? I mean, you just mentioned the oral intake. That would probably also help patients to have a better life or to improve their quality of life.
Most definitely. So instead of having to go to the hospital every month, every second month to have infusions, you might be able to take the drugs orally, which is, I assume, will be a benefit for the patients. We don't know yet, but assumedly it will. Another area where I think we'll go is, of course, the introduction of small molecules. The list of drugs that is being developed is increasing, which is, of course, for the benefit of patients. We have different options. In patients that might not respond on first-line treatment, we can now go to second, third, fourth-line treatments. And then I hope that we will go to combination trials where we use different types of drugs in those patients in order to get the most benefits out of it. Current treatments are still have a large proportion of patients that do not respond, that do not respond at all or lose response. And hopefully by combining drugs, by using either locally delivered or locally working drugs such as the anti-integrin inhibitors, this might improve outcomes.
So do you think that through combination therapies eventually in the future patients might be able to live burden-free or without a disease burden?
Well, that's a big question. I hope so. This is at least the goal. I mean, we are getting more and more specific in our targets with the drugs. And probably at some point we will be able to stratify patients. Some patients might need one drug acting on one target, other patients might need others, and the third group might need combinations. So in the future I hope that we will be able to tailor the treatment better for our patients compared to now.
And what do you hope to take away from this year's UEG week?
I hope to be updated on the current proceedings and all the trials. We are seeing a lot this year, and that's what I'm waiting for, and I hope to see more during the next couple of days.
Dr. Burisch, thank you very much for your time.
You're welcome.